Hi, Christine. My name is Lindsay. I'm your student nurse.
Okay.
As I'm walking into the room, I'm doing my 60-second situational assessment. I'm looking for the oxygen flow meter. And I'm looking for an ambu bag, suction canister, yank hour. I'm looking for any immediate tripping hazards in the room, like tubing, cords, spills, and most importantly, I'm looking at my patient to make sure she's breathing. Her skin is not blue, and she already said hi, so she's responsive to me. So, all right, I'm doing hand hygiene, and I'm gonna put on my gloves. So, can I take a look at your wristband, please? And can you tell me your name and date of birth?
Yeah, Christine McMahon, May 25th, 1988.
Awesome. So I'm gonna be doing a full head-to-toe assessment on you today. I'm just gonna be going through all the systems of your body and just getting a baseline of what you're at today. I'm gonna raise the head of the bed up for my working height, and then I'm gonna take a full set of vitals. But to save time on camera, I'm not gonna do that. Everything was stable. So, all right. So the first thing I'm gonna do is start with the head and the neck. So I'm looking at the head, I'm looking for any lesions, any pressure ulcers on the back of the ears or on the back of the heads. I'm looking in the eyes, in the nose, and the mouth at the mucous membranes, looking for any excessive like drainage, pus, redness, tears. Can you open your mouth for me? Stick out your tongue. Can you smile? And raise your eyebrows. This is part of the neuro assessment. I'm checking for symmetry in the face. Have you had any change in vision? Any ringing in the ears? Any change in your sense of smell or taste recently? Okay, cool. Can you lift your chin up to the sky? I'm looking for tracheal deviation and the presence of jugular vein distension, which I don't see any of that. Thank you. Any neck pain? No? Okay. I am going to use a light to shine in your eyes, and I'm just gonna check for your pupils. So go ahead and look straight forward. I'm shining the light in her left eye, and I'm looking for constriction. And then in the same eye, I'm gonna look over on the right eye for constriction. Okay. They are accommodating. Go ahead and just look at my pen, and then look at the wall behind it. So her pupils dilate when she looks further away. All right. And then you already told me your name. Do you know what month and year we're in right now?
Yes, July 2025.
And do you know where you are?
Yeah, Rosemont College.
And what are we doing here?
Head-to-toe assessment.
Great. So she is ANO times 4. She's alert. She's following commands. She's talking. Okay, so moving on to respiratory. Have you had any shortness of breath recently? Are you coughing up anything? Do you smoke?
Nope.
Any wheezing?
Nope.
And then any like difficulty breathing when you're like doing any day-to-day activities? Okay, I'm gonna listen to your lungs. So go ahead and take a deep breath every time my stethoscope touches down. All right. Clear. All right, everything sounds clear. There's no crackles. There's no wheezing. And then, are you able to roll over onto your side? I'm gonna listen to the sounds on your lung sounds on your back. Thank you. While we're here, I'm looking at the bony prominences on the sacrum, the shoulders, the elbows for any pressure ulcers, and I don't see any redness here. There are 8 sounds on the back. I'm gonna listen to 2 on the lower lobes, the middle, and then the upper. So take a deep breath. 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 Thank you. You can roll back. Sit the head of the bed back up for you. All right. When it comes to your heart and your cardiac system, have you had any chest pains recently?
No.
Do you get any dizziness or lightheadedness?
No.
Any heart palpitations?
No.
Okay. I'm going to listen to your heart as well. There's 5 heart points I'm going to listen to, starting at the aortic. Oh, you don't have to breathe. You can just breathe normally. Thank you. Pulmonic, Herb's point, bicuspid, and then the mitral, mid-clavicular, pardon my reach, and then I would listen to the apical pulse for a full 60 seconds, sorry. Listening for the S1 and S2 lung, or heart sounds. Okay, good. Thank you. Okay, so moving on to your digestion. When was your last bowel movement?
Yesterday.
Yesterday. Do you have any constipation or diarrhea?
No.
Any change in appetite recently?
No.
Nausea or vomiting?
No.
And then when it comes to your urine, what color is your pee?
Light yellow.
Any burning, frequency, any odors or discharge that you're concerned about?
No.
Or any itching?
No.
Okay, perfect. So I am going to inspect your abdomen if that's okay. If you could pull up your gown. So I'm looking at the abdomen for any distension, if she had any surgical sites, wounds, drains, anything like that. You don't see any redness, you don't see any swelling. And then I'm going to listen to your bowel sounds, if that's okay. So I'm going to start in the lower right quadrant. I'm listening for about 5 to 7 sounds every 15 seconds. And they sound like kind of clicking.
Before we start the secondary stage, I had documented and that so it seems like it was one of the
All right, thank you. And then I'm just gonna feel, do you have any pain anywhere in your abdomen?
No.
No? Okay. And as I'm feeling for any like distension or maybe signs of a hernia, but I'm also looking at her face to make sure that there's any pain while I'm doing this. Okay, and then if it's indicated to palpate the bladder, we could feel if it's full, but she doesn't have any indication for that. Okay, thank you. Yeah, so moving on to your extremities. So I'm just gonna feel down your arms. I'm looking at the color, making sure it's an appropriate color, and it feels warm. Do you have any pain?
Nope.
Nope. Any numbness or tingling?
Nope.
I'm looking for swelling or edema, which I don't see. I'm gonna feel the radial pulses.
Well, it's gonna lower. It's just gonna lower the.
And I'm making sure they're equal on both sides. Okay. Capillary refill. Less than 3 seconds. Making sure on both sides. Good. Can you squeeze my fingers for me, please? Thank you. And then put your arms up like this. Push against my hands. And pull against my hands. Awesome. Do you have any pain in any of your joints in your arms or hands or wrists?
Nope.
No? Any weakness on one side or the other?
Nope.
Okay, perfect. And then same thing on your legs. So I know you had a total right knee arthroplasty, so we'll get into a focus assessment on that. But for the meantime, I'm going to be feeling for temperature, making sure that both sides feel about the same temperature. Any pain? No?
Aside from the knee.
Okay, besides the knee, but no pain in this leg? Okay. I'm looking for edema. If she, she would have a gown on, I would be able to see her legs. Any numbness or tingling down here? Okay, that's good. So I'm gonna be feeling for 2 sets of pulses. The dorsalis pedis is right here. Feel them both. And then the tibialis posterior is right behind the medial malleolus, making sure they're equal. All right, are you able to push your feet against my hands? Good, and then pull your toes up. Are you able to lift this leg? All right, can you push against my hand? And then pull down. Good. Are you able to lift this leg at all?
Yeah, I have to kind of help it.
Okay, that's okay, that's enough.
Okay.
Thank you. But you can wiggle your toes, and you can put it back down. We won't test that. Okay, so because she had surgery on this leg, I'm inspecting the surgical site. I'm looking for any excessive redness, swelling, pus, drainage, any bleeding through the bandaging, and I don't see any of that. I also really want to make sure I'm assessing for edema and making sure that there's no swelling or restriction of the pulses down here. How's your pain on your knee today?
It's pretty good. It's probably a 2.
A 2 out of 10? Oh, okay. What's tolerable for you?
A 4.
Okay, so you're pretty comfortable right now.
Yeah.
Okay. And so did the pain start from the surgery?
Yes.
Of course. Okay. Does the pain radiate anywhere besides the knee, or is it just located in the knee?
Just in the knee.
Okay. And then does it come and go, or is it pretty?
Yeah, I'd say it comes and goes.
Okay.
Yeah.
Sounds good. And then how would you describe the pain?
It's just more of an ache.
Just achy.
Achy.
Okay.
Yeah.
Is there anything that makes the pain better?
Just having it propped up with pillows and just being able to rest it.
Okay, yeah, I can bring you some pillows in a few moments. We can do that. And then is there anything that makes it worse?
The walking has been tough.
Okay, so you walked with PT.
Yes.
Okay, yeah, we'll make sure we're staying on top of your pain meds for that too. And then, besides the pain medication and the pillows, is there any other treatments that help? Do you like ice?
Ice,
heat?
yeah,
Ice.
definitely
Okay.
ice.
Yeah, so we'll see. I know your doctor said it was okay to use ice, so when I leave, I'll come back with some ice and some pillows. We'll get you nice and comfortable. Okay. And then besides your surgery before that, did you have any issues with pain in any other joints in your legs, hips, ankles?
Nope.
No. And then do you use any assistive devices? I know we're sending you with a walker right now with the knee, but before that, were you walking independently?
Yeah.
Okay, sounds good. Cool. So besides your body, everything is feeling good. How are you coping with being in the hospital right now?
I'm ready to go home.
Yeah, ready. Definitely. Have you had any friends or family visit?
Yes, my husband.
Okay. And then who do you live with at home?
My husband and my 2 daughters.
Okay. And they're going to be helpful?
Yes.
Is there anything you need going home to feel safe? Okay.
So just the walker.
Yeah, just the walker, besides the walker. And then do you have staircases at home?
I do, but my bedroom's downstairs.
Okay, good. So you don't need to go upstairs. Otherwise, we can have PT work with you on how to get upstairs safely and down. Okay, good to know. And then, is there anything else I can get for you while I'm here?
No.
No? Okay. I am gonna go check on your pain meds. I'll get you a pillow and some ice. I'm leaving your call light right here. And I will be back in a few minutes. And, okay, is there anything?
No.
Thank you so much.
Thank you.
I think that's it.
I think, yeah.
I hope so. Woo!